This ASCO, I presented data for the CAPTIVATE study. This is a phase 2 clinical trial for previously untreated patients with chronic lymphocytic leukemia who need or have an indication for treatment. So this is a combination regimen for previously untreated with Ibrutinib plus Venetoclax. Ibrutinib is an inhibitor of BTK or Bruton's tyrosine kinase. Venetoclax is an inhibitor of BCL2. They have complementary activity in the clinic. So Ibrutinib is very effective at shrinking nodes, a little less effective at clearing blood and bone marrow of disease. Venetoclax is highly effective at clearing disease from the marrow and from the blood, a little less effective at reducing completely lymph node size. So they're complementary in the clinic as monotherapy, and so this trial is to evaluate the activity of the combination. There was also some preclinical data that supported this combination. Patients receive 3 months of Ibrutinib monotherapy to debulk them before we begin the Venetoclax. That's to debulk them and reduce their risk for tumor lysis syndrome, which was effective. We downgraded 77% of patients who were high risk at initiation of treatment down to medium or low risk, thereby avoiding hospitalization for those patients. And this was an early report looking at blood MRD data and bone marrow MRD data, and at an early point of 6 months of combination therapy, 77% of the patients were MRD negative in their blood. And then we had 14 patients who had finished the whole year of the combination of treatment, and there were 86% of those patients, 14 patients, who were MRD negative at the end of the year of combination. So this is preliminary data showing very, very active, very effective treatment, and it was well tolerated. We didn't have any unexpected toxicities or any toxicities that were a safety signal. So we were pleased, and the trial enrolled 164 patients, and we continued treatment for those patients and are looking forward to the updates.